Hello, everyone. Welcome to today's webinar. For those who are observing Ramadan, Ramadan Kareem to all of you. As you're logging on, you should see a poll on your screen. And we're really wanting to know how confident do you feel with regards to talking about mental health with newcomer youth. I'll give everybody a second just to fill out the poll as you're logging on here. We have a number of answers already coming in, and the poll is showing. Yeah, it seems like most people kind of feel somewhat confident in talking to youth about mental health. There's few of you who do not feel confident at all, and there's about 30% of you that feel very confident. So we'll give everybody just another second here. For today's webinar, our title, as you can see in the title, it's a part 2 to a mental health series that we're doing. Prior to today's webinar, you should have received an email asking you to rewatch or to watch for the first time our part 1 of the series. If you have not been able to do that, that's quite all right, but we would recommend that you go back and find some time to look at that later. Because today's presentation will be building on some of the concepts that were discussed last time in our previous mental health webinar. So with that, let's jump into some introductions for today. So I'm going to pass it over to my colleague Megan, who will introduce herself, and then we'll continue on with the presentation.
All right, thanks, John. Hi, everyone. My name is Megan Rafferty. I am the Behavioral Health Subject Matter Expert with USCRI's Refugee Youth Resource Center. I am a licensed professional counselor with over a decade of experience providing strengths-based, trauma-informed mental health services, including counseling and case management to refugee children, youth, and adults. And additionally, for the past several years, I've also had the privilege of providing training and technical assistance, such as this, to refugee service providers across our network.
And my name is Sean Dino, and I'm one of the trainers and resource specialists with the USCRI Refugee Youth Resource Center. I've spent over 20 years working in human service work, particularly youth programming, including 7.5 years doing humanitarian work in Iraq and Palestine. And prior to my work at USCRI, I most recently was a youth mentorship coordinator for a refugee serving organization in the Portland metro area. We also are joined by our colleague Geeta Rahimi, and she is on the back end of today's presentation. She is also a trainer and resource specialist with the RYRC, and she will be helping to drop links into the chat, responding to questions in the Q&A. With that, let's jump into some housekeeping things. First of all, as I mentioned, there is a Q&A section today. In the bottom toolbar or the side or the top, wherever you find the toolbars for Zoom, there is a Q&A function. There you can click on it and enter any question that you might have throughout the presentation. We will not be stopping to respond to those questions in the midst of the presentation, but for myself and Megan, we will try to do our best to respond to those questions throughout the presentation when neither of us is speaking. We also would really greatly appreciate your participation throughout today's webinar. We'll be using both the chat function as well as Mentimeter. So in a few slides, we'll have our first Mentimeter, and you can scan the QR code at that time and open up the window. And as a quick reminder, if you're having trouble moving forward to the next question, you can always just refresh the window. And then lastly, on screen, you'll see the QR code there. This is to access today's slides, so you can follow along as we're going through the presentation, or to reference them at a future time. So who are we as USCRI? We are a non-for-profit non-governmental international organization that is dedicated to address the needs and rights of refugees and immigrants. Our organization is broken down into refugee services, policy and advocacy, humanitarian legal services, anti-trafficking services, international programs, and child services. A part of children's services is the Refugee Youth Resource Center, and we are a national training and technical assistance initiative funded by the Office of Refugee Resettlement. Our goal is really to build provider capacity to foster refugee youth resilience and child safety. And we offer services such as monthly webinars like this, targeted trainings that can be done by request, a case consultation helpline, resource website for clients and providers, and a community resource directory. And all of that can be found at refugee-youth.org. So as was mentioned, this is a part 2 of the series. And by the end of this webinar, we hope that you'll be able to identify common signs of emotional distress and factors influencing newcomer children and youth emotional well-being. Second of all, that you'll be able to utilize culturally responsive approaches for discussing mental health with newcomer youth and their caregivers. And lastly, that you'll be able to recognize when and how to refer youth for additional support services. So with that, we're going to now jump to our first Mentimeter of the day. On the screen, you can see the QR code where you can scan or you can go to menti.com and type in 2309 8204. But what we're really looking for is to ask the question, what are the biggest challenges you've experienced when supporting refugee youth mental health? So take a second for everybody to log on here, and then we'll jump into showing some of the results. So it's about 30 of you who've joined. Got a few responses here. What are the biggest challenges you have experienced when supporting refugee youth mental health? All right. So we have stigma, cultural differences, language or language barriers, cultural differences, lack of family support, lack of information. We have reluctance, denial, ICE, trauma, fear of judgment. Yeah, these are all really great answers. Let's see, stereotypes. These are good. Access to mental health, access to counseling services, unsupportive caregivers. Yeah, these are all really great answers. Thank you, everybody, for those. If you want to just keep your window open as we continue on in the presentation, we are now going to talk about some of the ways that you can identify mental health concerns among newcomer children and youth. And for that, I'm going to pass it over to my colleague, Megan, who will now walk us through some of the ways that we can do that.
All right. Thank you, Sean. So I wanted to start things off today by talking about strengths. If you've watched part 1 or attended any of our previous webinars, you've already heard, many examples of the unique strengths and resiliencies that newcomer youth bring with them. So I'm not going to spend too much time here today. But as we begin having this conversation about mental health, I just wanted to make sure that this conversation is grounded in the shared understanding that newcomer youth possess significant strengths. They've navigated major life transitions, and many are extremely adaptable and highly resourceful. While many newcomer youth have experienced hardship or trauma, exposure to adversity does not automatically mean that a young person will develop a mental health condition. It's important not to make any assumptions and to recognize each youth as an individual with their own unique factors influencing their personal mental health. So, building on that idea that each young person is unique, it's important to remember that mental health is shaped by many, many factors, and it's never just one thing. Genetics and biology influence how youth respond to stress, and age and developmental stage shape what behaviors are typical at different points in time. Family relationships and peer connections can be protective when supportive, or increase stress when there's conflict or separation. Community and environment also matter, including safety, discrimination, belonging, and access to resources. Physical health and safety are foundational. Sleep, nutrition, chronic health concerns, and overall safety, of course, affect emotional well being. For newcomer youth, migration and life experiences play a role, including both the challenges that they've faced and the strengths that they've developed. Culture and religion shape how emotions are expressed, how distress is understood, and whether seeking help feels acceptable. Socioeconomic status and experiences within schools and other systems can either provide opportunity and support or again create additional stress. So, really, the key takeaway here is that mental health is multi layered. When a youth is struggling, we want to step back and consider the broader context, not just the behavior that we're seeing in the moment. And so, in part one of this series on mental health, we talked about the triple trauma paradigm, how newcomer youth may experience trauma in all stages of their forced displacement when they're in their home countries, during migration, and during resettlement. And I just wanted to take a couple moments to revisit the resettlement stage because, in addition to any past trauma that youth might have experienced, these are really the current stressors that might be affecting their mental health. So, first, resettlement is characterized as a period of intense cultural adjustment. Youth are often learning a new language, navigating unfamiliar social norms, and balancing expectations from home with expectations in the United States. They're navigating dual cultural identities. And some youth that I've worked with in the past have really described this as not fitting in anywhere because they feel like they don't fit in with the US born kids at school, but then are going home and also hearing their parents tell them that they're too American. And their friends abroad are telling them that they've changed and they're just feeling like so disconnected. Which brings us really into interpersonal stressors. So, youth may experience bullying, discrimination, or social isolation. They might be trying to make new friendships at school while trying to stay connected to friends that they left behind. They might be simultaneously grieving people that they've lost as they try to move forward. Family changes and conflict are also common during resettlement, as roles within the family often shift, which can create tension. So often, youth will learn English faster than their parents and then take on responsibilities like interpreting. I've heard stories of children being asked to interpret during their parents' medical exams or trying to help parents fill out important benefits paperwork that arrived in the mail and had an urgent deadline, which just puts youth in really awkward positions, often with like some power over the adults. But families feel like they have few other choices. So it's complicated and it can definitely change family dynamics and lead to conflict. Academic stressors are significant during this time period as well, as youth are learning an entirely new school system, starting to learn new material in a new language. Some youth find themselves way ahead in certain subjects, but then they still struggle to demonstrate their knowledge due to language barriers. And other youth might have had educational gaps and find themselves struggling to quickly catch up. And then socioeconomic stressors, such as financial strain, housing instability, limited transportation, or parents working multiple jobs, can add another layer of pressure. None of these stressors mean that youth will develop a mental health condition. but they can build up and they can overwhelm youth at times, and they can contribute to mental health concerns or even just intense periods where youth might just need additional support. On the next slides, we'll discuss some signs to pay attention to help you notice if youth are struggling. But first, we just want to hear from you. So we have another mentee here, and we'd like to know what signs or symptoms of mental health challenges have you noticed, newcomer youth that you've worked with experiencing? So how could you tell if a youth was struggling with their mental health concerns? All right, we'll just give you all another moment. Okay, let's see what the results are showing. Okay, I'm seeing isolation coming through like loud and clear here. Withdrawal, anxiety, shutting down, poor appetite, self-harm, behavior issues, bedwetting, sleep disturbances, low energy, no eye contact, aggression, anger, stomach aches, disengaging, internalizing. These are amazing. Yes. School refusal, sleeping too much. All right. Thank you all so much for participating in this. I really appreciate it. In our audience today, we have teachers, we have caseworkers, we have child protection workers, youth mentors, and so many of you are seeing youth sometimes every day, and you're often the first to notice when something feels off. And so clearly you all are picking up on a lot. So let's quickly just go through some of the signs and symptoms that we have listed here. Again, you've already hit on a bunch of these, but just to help you recognize when newcomer youth might need more support. So emotionally, you might notice fearfulness, worrying, or youth talking about thinking too much or ruminating. You may notice increased sadness, hopelessness, or feeling numb to everything, that sort of flat affect or seeming like they have a lack of emotion. You may see more irritability, getting easily frustrated or angry, blowing up over little things. And youth might also experience suicidal thoughts. We're going to talk more about determining when additional support is needed and how to access it. But of course, just want to make a quick note here that we always need to take suicidal thoughts very seriously and seek additional crisis supports for anyone having those experiences. Okay, next, it can be really common for newcomer youth to express emotional distress as physical responses. So pay attention if youth are frequently complaining about headaches, stomach aches, feeling tired, or having unexplained body pains, because these might actually be a sign that they're dealing with some big emotions that they're having trouble expressing in other ways. All right. And then, of course, behaviorally, you might see difficulty concentrating or remembering things, declining academic performance, and increased absences. Perfectionism can become an issue with some children or youth becoming hyper-focused on controlling things or not making any mistakes. Some youth might seem more withdrawn, not engaging with peers or family, staying alone in their room, while others might appear more reactive than usual. They might appear to be acting out more or being more defiant. They might easily feel startled, jumpy, or on high alert, and they might be having nightmares or sleep problems. In teens, we might also see an increased risk in risky behaviors like reckless driving, staying out late in unsafe areas, or using substances. And we should be on the lookout for any self-harming behaviors like burning or cutting themselves. And then finally, emotional distress might present differently in younger children. Young children don't have the language skills to express their emotions verbally, so we have to pay even closer attention to what their behavior is telling us. So young children might experience regressive behaviors or reverting back to behaviors that they had at a younger age. So a 6-year-old might start sucking their thumb again or using baby talk. A 10-year-old might start wetting the bed. We may see intense clinginess or being fearful of separating from caregivers or being alone. Increased tantrums and irritability are also very common. Sleep issues and nightmares. And focusing on traumatic events through repetitive play, drawing, or storytelling. So, for example, one child that I worked with in the past, he was around 5 years old when his father died very suddenly. He had a medical event at the home. Ambulance and fire responded. They took dad to the hospital where unfortunately he died. And the 5-year-old, he witnessed all of this. And so when I was working with this boy, he used to come into the playroom and every day he would pick out the ambulance and he would play with the ambulance every time during therapy, and just having the ambulance coming and taking someone away, coming and taking someone away. So this type of repetitive play is how young children attempt to process and make sense of confusing or scary experiences. So you may see things like that. And then last, of course, physical complaints are also pretty common with the young kids as well. All right, so let's talk more about when additional support is actually needed. Many of the signs that we just discussed are actually just very common for refugee children and youth who've experienced trauma. We've reviewed emotional, physical, behavioral signs of distress, but you also probably noticed that many of these are also just a part of our everyday human experience. Everyone feels sad sometimes. Everyone gets headaches or has trouble sleeping once in a while. So, how do you know when it might be something more or when a child needs more support? The key is to look at these signs in context and ask yourself a few additional questions. So, number one, is the emotional distress persistent, worsening, and or interfering with their daily living? How extreme is it, and how much is it impacting them? Are they feeling sad most of the day, every day for the past few weeks? Is their mood keeping them from going out and doing things that they used to like to do? Are they having headaches so often that their schoolwork is starting to suffer? And if so, they might benefit from some additional assessment and support. Second, we can ask, are there any safety concerns, such as self-harm or harm to others? Do youth talk about feeling like a burden to their family or feeling like things would be better if they weren't here? Again, if yes, it's critical that we connect youth to crisis supports or ongoing mental health services. And finally, third, do the mental health needs of the youth exceed your role or capacity as a provider? So if the answer to this is yes, it's important to consider talking to their youth and the family and getting consent to add in some additional supportive services, which is exactly what we're going to be talking about today for the next segment of this presentation in just a few minutes. One last thing that I want to note is that the reason that we're talking about these signs of emotional distress rather than diagnoses like depression or PTSD is because unless you're a mental health provider, our role is really to notice and support, not to diagnose or treat. It's much more important to recognize the signs of emotional distress and respond with care than to get focused or hung up on the clinical terminology. Okay. And now I want to talk about mental health across cultures. We did already discuss this a bit in part one, so I don't want to spend too much time here today. But it's just important to remember that mental health beliefs vary across cultures. The way that we define and talk about mental health in the US is not universal. In some other cultures, emotional distress may be understood as a family concern rather than something that's affecting just one individual. In others, distress might be viewed through a spiritual or religious lens rather than as a psychological condition. So, for example, a young person's depression might be understood as a test of faith or the influence of spirits rather than a mental health concern. Emotional distress is often expressed more commonly through physical symptoms like headaches and stomach aches, as I've already mentioned. In many cultures, there's not a clear separation between emotional and physical well being. So stress and trauma are just naturally described through the body and physical symptoms. This also might feel safer or more socially acceptable to talk about than emotions like sadness, fear, or hopelessness. And youth might not always have the language in any language to describe what they're feeling emotionally. Seeking mental health treatment can carry significant stigma, which can affect whether families feel comfortable asking for help. In some communities, mental health concerns might be associated with shame, weakness, or fear of community judgment, and families may worry that confidentiality or long-term consequences, might happen if they seek treatment. So our role is to approach these differences with curiosity, cultural humility, and respect, and to meet families where they are. Okay, and so I'm going to pass it back over to Sean to introduce our case scenario for today's presentation.
Yeah, thanks, Megan. Well, Megan did a great job of walking us through ways that we can identify some mental health concerns among newcomer youth. For this presentation, we're going to use one case scenario that's going to be broken up into 4 different parts. But I wanted to introduce you to our scenario today. We are joining a meeting between Yesenia, a adult mentor, and her mentee, Mariam, who is a 14-year-old girl from Afghanistan who has lived in the United States for a year. So this is a meeting that they're having, and we're going to be jumping right into the conversation here. So we'll follow it up with a few questions afterwards, but let's hear how the conversation goes.
Hi, Miriam. It's great to meet you. How are you doing today?
Hello, Yesenia. It's very nice to meet you. I'm doing well, thank you.
I'm so excited for us to be working together. I'd love to spend some time today learning more about you, your life, and your goals for our time together.
Okay. Well, I live with my mother and 4 younger siblings. My father passed away in Afghanistan. That's where I'm from. He was taken by the Taliban. I don't like to talk about it very much, but I miss him a lot. We were very close. Now, it's just my mom taking care of us. She works full-time at the factory, so she isn't here a lot, and it's up to me to take care of the younger ones.
That sounds like a lot of pressure.
Yes, sometimes they really get on my nerves. They're always bugging me to go outside and play, but it's not safe. Or they ask me to help with their homework, but I have enough trouble with my own homework.
How is school going for you?
I hate school. I don't have any friends. There's no one else like me here. The other kids tease me about my accent and make fun of my clothes. It's lonely, but I still talk to my friends back home as much as I can. I miss them and I worry about their safety all the time. Sometimes it's so hard to concentrate in my classes because I am thinking about them. My mom says I am thinking too much, but I know she is doing the same thing. At night, when I can't sleep, I hear her tossing and turning as well.
I'm so sorry to hear that. That must be hard for you.
Yes, I got in trouble for falling asleep in class last week, and a few months ago, on the bus ride home, I fell asleep and missed my stop. I had to walk so far.
So we're going to now jump back into Mentimeter. If you want to scan the QR code, or if you have the window open, you want to return there, we're going to ask a few different questions about the case scenario. But before we do, I just wanted to remind everybody as a note that in this case example, Mariam opens up very quickly and is really eager to share about her history and her current life. While in this case scenario, we have shown her opening up very quickly because we want to use this as a relevant tool, learning tool for all of us. We want to remember that the reality for many youth is that it may take a lot longer for them to open up after several meetings of building rapport and trust with the provider for them to share. So for the first question that we have about the case scenario, what resettlement stressors is Miriam experiencing? Let's now show some of the results, and you can continue to put those answers in there. But we have bullying loss of family member, loss of home base, fatigue, pressure from family, loneliness, no friends, language barriers, responsibilities beyond her age, sleep loss, cultural adjustment, insomnia, survivor's guilt. These are all extremely, um, uh, you know, important answers that you're putting down here for us to keep in mind as we think about the case scenario and as we're working with youth. These are all things that are very common for many youth who come to the States. Trouble adjusting to a new school, new roles at home, family dynamics, post-trauma. Yeah, these are all really great. Thank you for those. Let's jump to the next question. What signs of emotional distress do you notice in Mariam? Give everybody a second to respond to those questions. Again, if you're having trouble moving to the next question, you can just refresh your window. What signs of emotional distress do you notice in Mariam? Show some of these. Insomnia, trouble sleeping, hopelessness, anxiety, hates school, irritability, difficulty with schoolwork, yeah, anger, tiredness. Yeah, you guys are really drawing out things from the case scenario. Laughing, other people laughing at her clothes. Yeah. Yeah. And then the last question that we have here are what protective factors do you notice for Mariam? What things can Mariam kind of turn to or um, kind of rely on to help her through some of the mental health issues that she's dealing with? Friendships in home country, yeah, talking with friends, her speaking up is really important, that you learning to use her voice, her siblings, her family, responsibilities, the fact that she has a mentor that can potentially counsel her, her religion, yeah, um, yeah, openness and honesty. Yeah, so thank you all for these questions. We're going to now jump back to presentation itself, and we're going to now kind of talk about how to engage newcomer youth and their caregivers and how to overcome barriers when addressing mental health concerns. So I'll pass it back over to Megan, who will walk us through some of these slides.
Great. Thank you, Sean. So let's see. Even when we recognize that refugee youth might benefit from support, accessing services is not always simple. There are lots of barriers, structural barriers or system level obstacles that are, shaped by policy and largely outside of a family's control that might influence their ability to receive services. So families often have to navigate the complex mental health systems and might struggle to find culturally responsive providers with experience working with refugee youth. They may have limited insurance coverage, high copays, and broader socioeconomic stressors like working multiple jobs, which can make services financially and logistically out of reach. Language barriers and limited access to high quality interpretation further complicate care. Time and competing priorities also plays a role as youth and caregivers have to juggle school, work, caregiver responsibilities, and other daily demands. Immigration related fears may create hesitation about engaging with formal systems or even leaving the house to seek services. Transportation can be another challenge if clinics are not located near where families live or don't offer virtual services. And while school-based mental health services can reduce some of these barriers, they're not available in every community. So next up, I've got a list of individual and cultural barriers. So in addition to those structural barriers that we just went through, these individual or cultural barriers are shaped by beliefs, values, and lived experiences. As we've already discussed, families may have different beliefs about mental health concerns and treatment. In many cultures, discussing personal issues with someone outside of the family feels unfamiliar or it might feel inappropriate. Stigma, as I saw you all mention in some of the mentees so far, is another powerful barrier. Stigma refers to negative attitudes, beliefs, and stereotypes that people might hold towards those who experience mental health conditions. So when stigma surrounding mental health is high, concerns might be associated with shame, weakness, or dishonor, leading families to fear judgment or community gossip. Over the years, I've had many clients who could overcome their personal stigma towards services and say, hey, I need help and I'm interested in trying this. But they were still very afraid of their family members or community members finding out that they were receiving mental health services. So that ended up leading to a lot of questions and concerns about privacy and confidentiality. Additionally, in some countries, mental health care is really limited or reserved for severe conditions, which can lead to confusion or hesitation about what counseling is and how it can help, because it's just not widely available in other places like it is here. Past experiences and current events might also contribute to a mistrust of formal systems or concerns about how engaging in counseling or sharing information might affect immigration status or future opportunities. Because many children and youth depend on caregivers to access services, parental hesitation can directly impact engagement as well. And I feel like I've heard all of these responses show up in our earlier mentees. So I know I'm speaking to people who really understand about these barriers to services. But, understanding these barriers in this way can help us see a family's hesitation in a different light, perhaps. There are a lot of obstacles that might be in the way, and it's our role to reduce barriers when we can and meet families where they are. In the rest of this section of today's training, we're going to talk through some strategies to help address some of these barriers and increase your chances of success when talking with youth and their families about mental health concerns and treatment. All right, so to begin, I want to provide just some general tips for folks who don't primarily work with children or maybe feel less familiar working with youth. A few small shifts in your approach can make a big difference. So first, use a trauma-informed and strengths-based approach, of course. That can look like being really transparent about your role, sitting at their eye level to reduce power imbalances, and offering choices when possible. Focus on strengths and resources rather than deficits. Before jumping into mental health topics, it's recommended to build rapport, trust, and safety in the relationship. Especially due to stigma, these conversations will go much better when youth feel seen and respected. So this is just about showing a genuine interest in who they are and what they care about. Next, ask open-ended questions. Teens in particular might shut down with yes or no questions. So instead of a question like, hey, are you okay? Maybe try, how are you feeling about what happened today? How are you feeling about, that fight that you had with your mom? Open questions invite a lot more conversation. Next, demonstrate deep listening. Make eye contact when appropriate. Use nonverbals like nodding your head or leaning in. Stay off your computer and your phone to show that you really care about what they're saying. Use developmentally appropriate language. So use concepts that the child can understand. We're not going to have the same conversation about mental health with a 5-year-old that we will with a 15-year-old. So with younger kids, try to use more simple and concrete words. Next, incorporate movement, art, or writing when possible. So younger children might express themselves better through drawing or through play. With teens, I have found that if you can go for a walk, that is like truly one of the best tools that you have. So when you're like standing side by side and walking, you don't have to worry about eye contact or awkward silences, and conversations just feel so much more natural. So highly recommend that if it's, possible. And then finally, use professional interpretation if needed. Expressing emotions in a second or third or fourth language is difficult. And these are conversations where, clarity really matters. So think about if you need to utilize an interpreter, even if it's just for, a few conversations about mental health. Okay. So now let's talk more about how we can work towards overcoming stigma towards mental health, since this is such a large barrier and it comes up so often when talking about newcomer youth and families. Overcoming stigma towards mental health, it can take a lot of time and patience, but our approach to how we talk about mental health and the language that we use can make a big difference. So first, instead of using clinical terms or jargon, focus on what you've actually observed about the youth's functioning, or focus on even what you've heard from them in their own words. So for example, instead of saying, I think you're depressed, talk about what you've observed that makes you think that. I've noticed that you've seemed really down and lost in thought lately. And you said you haven't been playing soccer as much as you used to, right? Then you can normalize and validate those experiences. So that might sound like it's very common to have times when it feels hard to enjoy things, focus, or have energy, especially after going through big life changes like moving to a new country. You're not alone. I've known many other kids who felt that way too. Next, I find that it can be really helpful to align with the youth's personal goals. So, taking what you know about them, you can help them make the connection between how getting support for their mental health would help them achieve their goals. So, for example, you mentioned before that you want to try out for the high school soccer team. It seems like getting some help with your mood and energy level might be important to you so that you can start practicing again. Then providing some psychoeducation about mental health, the impacts of trauma, and the purpose and benefits of counseling can be helpful. So saying something like, sometimes when our mind and body go through stress for a long time, it can affect our sleep, our mood, and even how we see ourselves. It's not a weakness and it's nothing to be ashamed of. It's a very human response to difficult experiences. A counselor is someone whose job it is to listen and help young people sort through what they're feeling and find ways to cope. Emphasizing privacy and confidentiality in mental health services can also help those who fear judgment from their family or community. So maybe saying most of what you share in counseling is private. That means that it stays between you and the counselor unless there's a safety concern or someone else might get hurt. And if that ever came up, they would talk to you about it before sharing anything. It's also important to ask about the family's views of mental health. Do they see emotional distress as a spiritual concern or an issue of morality? And what questions do they have about mental health treatment? You might ask something like, how is sadness, worry, or grief commonly expressed or coped with in your culture? What would you do to feel better if you were back home? Cultural humility and demonstrating respect are an absolute necessity as we navigate these strong cultural beliefs. So again, that might sound like you're the expert of your own experience. What ideas do you have about what would help you feel better? And finally, due to stigma, some newcomers may see seeking support for mental health as a weakness. And it's really critical to reframe getting help when you need it as a strength. So saying something like, I know you're a very strong person. reaching out for support is another kind of strength. Okay, and so I just also wanted to share a few examples, even more than what we've already shared, about how we might shift our language to be less stigmatizing. So instead of saying treatment, we can say support. Instead of therapy or mental health services, we can use the term counseling. Instead of depression, anxiety, or trauma, we can talk about stress. And overall, we can talk about how mental health services, have the goal of helping youth succeed by teaching them new skills and coping strategies. This really shows that counseling is skill-based and future-oriented, again, aligning with the youth and families' personal goals to help them see the benefit of counseling. All right, and so now I'm going to pass it back to Sean to revisit our case scenario.
Yeah, thanks, Megan. So Megan has just walked us through some really practical ways that we can come alongside and support newcomer youth through various mental health concerns that might be arising. Right now, in our case scenario, Yesenia has built a safe and supportive relationship with Mariam. However, Mariam has started to share more about her mental health challenges with Yesenia, and these are things that include her past trauma. This has led Yesenia to feel like these conversations are more than she is capable of responding to as a youth mentor. And so now we're going to see how she follows up with Mariam about this.
Hey, Mariam, how are you doing today? You look tired again.
Yeah, I had a nightmare about my dad again last night. I just kept thinking about it and I couldn't get back to sleep.
I'm sorry to hear that. You are so strong and have been through so much. It's normal to feel sad and to miss your dad, but it seems like your nightmares are getting worse, and it seems like it's affecting your schoolwork too.
Yeah, I thought things would be better in America, but I can't stop thinking about everything that happened.
That makes sense. You've been through so much. After scary or overwhelming experiences, the brain sometimes stays in alert mode, even when you are safe. That can cause nightmares, trouble sleeping, or feeling like the world isn't safe. And sometimes it's actually not until you're safe that some of these things start coming up. Luckily, in the U.S., we have people who you can talk to who have been through special training to talk to kids about scary or difficult things they have been through. They'll know strategies and skills to help you with your sleep, nightmares, and worries that get in the way of your schoolwork and you having fun. I'm so happy that you felt comfortable sharing with me, but I think a counselor would be a better person to talk to about your past while you and I focus on your future.
I've heard about counselors at school. I think I'd like to try it. I really want to feel better, but I'm worried my mom won't like it.
I know your mom loves you and only wants what's best for you. Why don't we talk to her about it together?
Thank you. I'd like that.
All right, so we're going to now jump to our Mentimeter. Already a few of you have started putting in your responses, but what approaches do you notice in the conversation between Yesenia and Mariam? Give everybody a few more minutes to get back to Mentimeter and to put in some of your responses. Yeah, it seems like everybody is picking up on the correct answers here. Right now, focusing on strengths is a really big thing that Yesenia was doing. And she was normalizing the experience that Mariam was feeling. What was going on with her, she was comparing it to other youth that she's worked with, as well as she was trying to avoid using non-stigmatizing language. She didn't say you have PTSD. She did not say, I think you're depressed. She avoided those terms altogether and instead provided psychosocial support about trauma and about counseling. She told her that when your body is going through trauma and shock, that it can be in that protective mode. She talked about, what a counselor does and provided psychosocial support. So yeah, you guys are all picking up on the right answers here. There's one more question here that we're going to ask, but how would you approach this conversation with Mariam's mother? So Yesenia talked about the fact that she wanted to refer Mariam to a counselor, but Mariam expressed that her mother may have hesitation. So take a second to think about how you might approach that conversation with Mariam's mother. And this will be our next video that we'll be watching in this case scenario. So what approaches would you take? Again, if you're having trouble with this next question, you can always refresh the window and it should hopefully pop up. All right, so build trust and rapport. That's a really important one. Have an activity for us to do while we talk to Mariam's mother, talk about Mariam with her mother. Bring interpretation. That is a huge one, especially if they're that English is a second language. If people do not feel comfortable really communicating in English, interpretation is really huge, because we want everybody to have the same understanding and to fully grasp all that we're trying to communicate. Psychosocial education on mental health, using non-stigmatizing language, creating a trusting environment, using non-clinical language. These are all really great answers. Provide more information, explain that it would benefit her at school and at home. Yeah, that's really important point. Being respectful and coming with an open mind on any feedback that is received. It's really good. Learn and validate the mother's concerns. It's a really important part. We don't want to push families away. It can be a really big protective factor to bring families in to this whole process of supporting youth, especially as they're navigating multiple cultures at once, for parents not to feel sidelined. Yeah, these are all really great answers. So thank you all for responding here. Let's jump back here to our next slide. And I'll pass it over to Megan to talk about ways that we can have conversations with parents.
All right, wonderful. Thank you. So yeah, thanks everyone. A lot of great ideas in the last Menti, but let's just dive in and talk about some general approaches to talking with caregivers. So parents and caregivers, they shape their child's daily environment and are often central to both healing and accessing services. So how we approach these conversations with them can significantly influence whether youth get connected to care, remain engaged, and make meaningful progress. So when speaking with caregivers, first be intentional about the time and place. Choose a private, confidential setting and ensure that there's enough time so that the conversation doesn't feel rushed or interrupted. Work to build trust by approaching caregivers with curiosity, humility, and respect for their cultural values and parenting experiences. It's also important to align with caregivers' goals. So emphasize that you share a common priority, their child's health and safety. Framing the conversation around shared goals can reduce defensiveness and increase collaboration. We've already talked about stigma related to mental health, so be sure to include those strategies in your conversations with caregivers as well. Provide brief, clear psychoeducation, explaining what counseling is, what sessions typically look like, and how it can support their child. Offer simple information about trauma and the potential impacts on behavior, learning, and emotional well-being. And finally, do not minimize caregiver concerns or barriers. acknowledge the logistical challenges or the cultural beliefs that might be impacting their decisions. Validating these concerns helps maintain trust and keep the conversation open. All right, and so I know that I have mentioned psychoeducation quite a few times today. So now is the time. We finally have a moment to talk a little bit more and explain further what psychoeducation is. So for those of you who are unfamiliar with this term, psychoeducation includes using clear, plain language to teach youth and families about mental health conditions, symptoms, and treatment. It can also include teaching coping strategies like breathing techniques or visualization to help the youth manage any symptoms that they're currently experiencing. Psychoeducation can help the youth and families that we work with better understand some of the experiences they're having. It can help them feel less alone and know that help is available. And it's particularly useful when we're working with stigma because there are a lot of opportunities to dispel myths, answer questions, and have open, shame-free conversations about mental health. So the more that we talk about mental health and normalize it with youth and families, the more that we will destigmatize it. And last, I'll add that psychoeducation is something that pretty much anyone can do. You really don't need to be a therapist. You just need to have some accurate, unbiased information about mental health to share. So here are a few examples, very, very brief examples of what that might sound like, just to give you a better sense of what we mean. So stress affects the brain and body in different ways. These types of reactions are common after big changes like the ones you've been through. Experiencing these emotions doesn't mean that you're crazy. Support is available and can help your family get through this hard time. And counselors can help teach you new ways to cope. Okay, and we've also mentioned that talking to newcomer youth and families about confidentiality and privacy in mental health services might help them feel more comfortable engaging. Ultimately, it's the mental health professional's job to fully and clearly explain confidentiality, but if you can include any of these points in your psychoeducation with youth and families, it can be very helpful. So some points you might include, mental health information is private and protected by law. Counselors can't share what you tell them with other people without your permission unless there's a safety concern or a court order. Parents are usually involved in services for children, but teens may have to give their permission to include parents. And you can ask questions about your privacy or your care at any time. Okay, so we have covered a lot. And if you're feeling overwhelmed at all, I just wanted to take a moment to let you know that we've created 3 written resources that go along with this webinar. So, of course, you'll have access to this slide deck and the recording after the webinar today if you wanted to go back and revisit anything. But we've also created a guide for providers that offers a refresher on these practical tips that we've shared so far about engaging with youth and caregivers, overcoming stigma, and providing psychoeducation. So check that one out. And we've also created 2 handouts for caregivers with tips for supporting their child's day-to-day well-being and for having conversations about emotional well-being with their children. So these are currently only available in English, but they will be translated and made available on our website in the coming weeks. And I see that Geeta has dropped the links for these in the chat, so be sure to check these out. All right. And moving on, next, I just wanted to talk about traumatic or sensitive disclosures. So when you're talking with youth about their mental health, it is not necessary and very often not appropriate to ask them about their trauma history. You do not need details about what happened in their home country or during their migration journey in order to provide support. Unless you're a mental health professional that's doing, a formal assessment or some trauma-focused treatment, pushing for disclosure about past trauma can be unnecessary and potentially even harmful. But that said, sometimes during the course of our work, Even when we did not intend for it, youth will sometimes share about the hard details of their past. And sometimes, especially for, folks who weren't specifically trained to hear some of these trauma stories like mental health professionals are, it can be really difficult to hear and you might not know what to do. So we've got some tips for you. When you're in the moment, you're still sitting there with the youth. First, do your best to stay calm and regulated. That can be easier said than done, but you can focus on your breath, on the physical sensations, like the feeling of the chair that you're sitting on, or your feet touching the ground. And you can use your own calm, regulated state to help the person that you're talking to manage their overwhelming or intense emotions. And really, this is so important because the last thing that you want is for the youth who's sitting across from you talking about their trauma. The last thing you want is for them to worry about you because you're getting upset. So again, just try to stay calm so that we can center the youth and their needs during these conversations. Show them that you care and encourage them to seek professional support. As much as you want to be there for them, recognize your own limitations and know when to turn to professionals. Watch for safety concerns and use safety plans as needed. If there's any talk about wanting to harm themselves or others, or if they are still currently in dangerous situations, safety plans, crisis supports, or mandated reports might be necessary. And then again, as already mentioned, avoid asking for any additional details. And then after you've had that conversation with the youth and maybe something traumatic or sensitive came out, gain their permission before making a referral to a mental health specialist. Maintain confidentiality and don't share what you learned without getting their consent first. Consider checking in more frequently than you would otherwise just to make sure that they're doing okay. After opening up some of these wounds or sharing those details, it can be re-traumatizing and youth might experience an increase in symptoms or feel worse for a while afterwards. Seek supervision to care for your own well-being and talk through the situation and how you responded with your supervisor. And practice self-care. It's easier said than done sometimes, but doing something like going outside to get some fresh air, maybe going for a walk, watching something that makes you laugh. Just make sure that you're taking care of yourself as well after hearing something that might have been hard to hear. All right, so now I'm going to hand things back to Sean so we can see what happens next in our case scenario and we can lead into our final section. Sean, you're muted.
Sorry. Yes. Thank you, Megan. In our last case scenario, we ended with Mariam kind of expressing concerns about sharing about counseling with her mother. Now we're going to pick up with Yesenia having a conversation with Mariam's mother, Aziza, and see how she approaches this.
Good evening, Aziza. How are you doing today?
I'm good, thank you.
Aziza, Mariam and I wanted to talk with you about something before I go. Is now a good time to talk?
Yes, of course.
During our meeting today, I let Mariam know that I am a bit concerned about her sleep. Mariam works so hard, but over the last few months, I've noticed she is very tired and it's impacting her schoolwork. She has also been thinking a lot about the past and feeling sad about missing her father, and let me know she has even been having nightmares about what happened. Your family has been through so much, and it is totally normal to still think about the past sometimes. But I also know that there are people here in the U.S. that could help Mariam feel better. Counselors that she could talk to about her stress and who can teach her skills and coping strategies to help her sleep better. What would you think about her talking to a counselor?
A counselor? To talk to about her stress? No. She doesn't need this.
Mama, Yesenia thinks it could help. I want to try.
I know that in many other countries, seeing a counselor means something else. It means someone has a severe illness, but it is very different in the U.S. Lots of children and adults go to see counselors. It is very common here. Some children might talk to a counselor after big life changes like moving or a death in the family, if they are having trouble with friends, or just having big emotions they need help with. It doesn't mean there is something wrong with them. Counselors are professionals who help people during times of stress. It is entirely up to your family to decide. I won't pressure you. But do you have any questions I can answer?
I worry about what other people will think. They will judge us. And what if this counselor takes her away from me?
I know you love your children very much and that you want to protect them and keep them safe. Counselors are required by law to keep everything they talk about with their clients private, and all their records are confidential. They won't share anything without your permission unless they have a safety concern, because like you, they want to keep children safe. You can also meet the counselor and be involved in the beginning to make sure you feel comfortable with them. Is there anything else you are worried about or any other questions you have?
I'm not sure. Mariam and I will talk more about it and decide.
That sounds good. I'll check back in with you about it when we meet next to see how you're feeling. If you have any questions or make a decision before then, let me know.
All right, so let's jump to Mentimeter here and give everybody a few seconds to get back to the window. But thinking about the video that we just watched, what did Yesenia do well in the conversation with Mariam's mother? How did she approach this conversation, or what things did she talk about that went really well? So let's see some of these answers. She gave them options, which is a really good thing, especially when people are faced with trauma. She reassured her, and she didn't use forcing language. Yes, no pressure. So really good things. A number of you are pointing that out. She explained about their rights and explained about counseling in the U.S. She asked permission, which is also a really good thing, trying to destigmatize counseling. She empowered the mother. Yes, that was really good. She kept, leaving it up to the mother to decide and not pressuring her. She left room for questions, which is really important. We can come with an agenda and we might say a lot, but we want to make sure that families have all the information that they need to make the right decision for them and their family, but also to kind of get those questions answered. She was patient, yes. She was very kind. Explain confidentiality. Yeah, you guys are picking up a lot here, and it's really, really, really good. So, what could have Yesenia have done differently? This may be a more challenging question to answer, but when you think about the situation, and there's no right answer here, but what could Yesenia have done differently or more effectively that could have helped get Mariam's mother to understand and agree to counseling? Give you a few seconds here to respond. Again, there's no right answer here. All right. Yes, she could have confirmed the need of interpretation before coming into the meeting. Asked about what counseling means in their home country. Really good idea. Could have given examples of coping techniques Mariam could learn in counseling. Yep. Ask Mariam to explain her feelings about counseling. That's a really important part. So we want a centered youth voice in our conversations, and help the mother to understand why Mariam might feel the need for counseling or agree to that. Ask her what her concerns are about Mariam at the start. Give her literature about counseling. Listen to her more. Yeah. Yes, these are all really great examples. So with that, let's jump to the next section here, where we're going to talk about community resources to support newcomer youth mental health. So in this section, we're going to talk about how we can support newcomer youth. And we want to start with one discussion question. This is what we're going to do in the chat. But what are some types of services and supports that are available in your community to support newcomer youth mental health? So this is a great way for us now to tap into the resources, the services that each of you are bringing. And this could awaken things within the audience here of how they could maybe approach mental health conversations with newcomer youth in their local communities. So Geeta will now enable the chat, and you should be able now to be able to put some of these types of services and supports that are available in your community. So yes, after school youth programs for children with similar backgrounds, that is a great service that you could connect youth with. 899 Crisis Line, yes. I think Megan is going to talk a little bit more about Crisis Line just briefly, or 988. I think it's the correct answer is 988. Support groups, yes. Newcomer centers, yeah, these are great. Language support, multicultural counseling services. That's really important to have that cultural aspect in counseling. Yoga and art classes. As an art major myself, this is one that touches my heart. Mental health first aid training. Yeah, this is great. Networking youth events. Yeah, individual therapy. Give everybody just another minute before moving on. But as we move on in the presentation, you can continue to put some of these resources here because I think it's really helpful for everybody. School social work services, partnering with private counselors serving refugees, soccer and sports activities. As a soccer player, this is another one that touches my heart. Really great to get them active. Again, Megan talked about a great way to support youth is through movement, and sports are a great way to do that. Youth mentoring programs, interactive activities, volunteer opportunities. That's a great one. Them serving back and giving to the community. Yeah, thank you so much for these answers. I'm gonna pass it back over to Megan to talk about resources in the community and ways that we can support youth. So back to you, Megan.
Thanks, Sean. And thanks everyone for the, great ideas that you've put in the chat. I always love hearing about the different types of supports and services that are available in other communities. And it's always great to get some new ideas from you all, which I always learn something, even when I'm the one that's facilitating the webinar from our audience. So thank y'all so much. Let's go to our next slide here. And we've got, just a long list here to just some ideas for how we might support youth. This is not comprehensive. There's so much more that is on this list. But we just wanted to provide some alternatives because even though much of our training today is about supporting youth in seeking mental health treatment, not all youth experiencing emotional distress will need or want mental health treatment. And there's just so many other options for support that's available. And healing can happen through so many different pathways, through safe and trusting relationships with others. So that really includes a lot of people, places, and activities, including family, cultural leaders and elders, faith leaders, prayer and meditation, traditional healers and rituals, movement, dance, and yoga, art, music, writing, storytelling, and cultural craft, time in nature or gardening, physical activity or sports. And on this list, last but not least, is peer support groups. So these can be a really powerful form of community support where youth can hear about and relate to one another's experiences in a space that feels safe and largely pretty free from adults, other than one facilitator, most likely. And children can offer each other hope, they can offer advice. I've been a facilitator for some of these groups in the past, and like they are forever just like etched in my heart because they have been some of the most beautiful and healing spaces that I've ever seen. So, highly recommend groups whenever possible. And so I'll bring us to our next slide here, which is about mental health services. Again, the more traditional or formal services. Sometimes these are the most appropriate next step. And so just wanted to build a little familiarity with some options that might be available. And so first on this list, you'll notice that I also have psychosocial support groups listed because these might take place in community settings, and sometimes they take place in clinical settings led by mental health professionals. So when you're building out your referral network, I just want you to consider both community-based and clinical group options, when you're trying to build up a list. Next is individual therapy or counseling. There are many approaches beyond traditional talk therapy, including play therapy for children, as well as art, music, and movement-based therapies. Different modalities can be matched to a child's age, developmental level, and needs. Family therapy is another option. This can be particularly helpful when the concerns are connected to family stress, communication patterns, or changes in family roles. At times, supporting the entire family system is key to improving a young person's well-being. Medication management may also be a part of treatment for some youth. They're sometimes used alongside therapy and can be effective for certain conditions. And then finally, I have crisis services listed here. These are hopefully available when immediate support is needed. So many communities offer mobile crisis response teams that can provide in-person assessments. The 988 Suicide and Crisis Lifeline is available by call or text for urgent emotional support with interpretation available. And emergency departments remain an option in situations involving immediate safety concerns. So really understanding this continuum of care can help you guide families toward the level of support that best fits their needs. All right, and so now that we have, learned about the different types of supports and services that might be available in your community, if you don't already have a robust referral network, it's important to work on building one out. So if we're going to be encouraging youth and families to seek mental health care, we need to have places to refer them. And I know that in many communities, this is not an easy task. This is a major challenge due to a lack of trained providers and funding challenges. So when you don't have established referral pathways or trained providers, ready, you might need to start with some capacity building by approaching mainstream providers, determining if they have an interest in serving newcomers, then providing some additional resources and training to help prepare them to work with newcomer youth. And just a quick plug for the RYRC, we might be available to assist with private training and consultation to support your capacity building. So reach out to us if you have any questions. When you're considering adding new providers to your referral network, just at a minimum, ensure that they are expressing cultural humility, they can utilize professional interpretation, and are flexible enough to work around and support with barriers to accessing care. For a little more on building out your referral network, I've also included a list of where you might go to look for mainstream providers. If you're unfamiliar, mental health services are offered at many different locations. So you can look to community mental health centers and integrated primary care clinics, such as those at federally qualified health centers or FQHCs. Both of these have a high likelihood of accepting Medicaid or providing free or low-cost services. Also look into services that might be available at the schools where many of your, newcomer youth might be placed at. You can search for community-based organizations, university training programs like social work or counseling programs, hospital outpatient programs, private practice, and national telehealth networks. A great place to start your community mapping is the RYRC's Community Resource Directory to search for affordable mental health providers in your community. I think I just saw Gita drop that link for you in the chat, so you can open that up now and check it out later. Okay. So now let's assume that you have identified appropriate service options. We just want to briefly talk about how do you connect youth and families in a thoughtful and effective way. So with the youth and or the family, obtain consent before sharing information, support them in navigating any barriers, and set clear expectations. So this is really helpful, explaining what services might look like, how often appointments occur, and what the first session typically involves. The more that you can prepare and reduce the uncertainty, the more likely that the referral is going to be successful. With your referral source, make sure that you're ensuring language access and that the provider has an ability to communicate with the family's preferred language and dialect. And provide only need-to-know information that will support their care while respecting privacy and confidentiality. You don't need to share every single thing that you know or happen to the youth that you're working with, just as much as kind of need to know. All right, and with both, offer a warm handoff whenever possible. So this might look like making a call altogether or facilitating a joint introduction. And follow up regularly. Check in to make sure that the family actually connected and identify any additional support if it's needed. Follow up is really helpful, really significantly increases the likelihood that services are accessed. Okay. And even when we approach these conversations thoughtfully, a youth or caregiver might decide that they're not ready to engage in mental health services. This is really common, and it doesn't mean that the conversation is over. Just continue to share your observations and concerns in a way that demonstrates caring. Keep normalizing and validating the youth's feelings and the caregiver's perspective, letting them know that seeking support is one option and it's not a requirement. Provide ongoing psychoeducation and teach simple coping skills that they can use even without formal services. Identify alternative supports that the family might be more comfortable with, like we've already mentioned. Continue helping to address barriers that might be influencing their decision. And most importantly, be patient. Trust develops over time. It can take multiple conversations before a family feels ready to move forward. Okay, so now I'm going to hand it back to Sean to wrap things up with our case scenario and take us through the end of our presentation.
Thanks, Megan. Yeah, so for the last time, let's return to Yesenia and Mariam. For context, after a few more conversations with Yesenia, Aziza, Mariam's mother, agrees to let Mariam go to a counselor at her school on the condition that it doesn't interfere with her academic classes. The video picks up to check in with Mariam after she meets her counselor. So let's listen.
How did it go?
Mama came to meet her at my school and asked a lot of questions. The counselor was so nice, even Mama liked her. We had to sign a lot of papers, but she said it wouldn't be like that every time. We talked about the past a little and my goals for sleeping better. She said it will probably take some time, but that she has helped a lot of other kids like me feel better. I hope that's true.
I hope so too. I'm really glad you liked the counselor. Do you have any other questions or issues that came up?
No, the counselor said she can meet with me during gym so I don't get behind in my other classes. That made Mama happy too.
That's great. Keep me updated about how it's going.
All right. So as we come to the end of today's presentation, for our final interaction, we want to hear from you and hear what from this training benefited you. So take a second. The chat should be open again. And we would like to know what's one strategy or new piece of information you're taking away from this training that you'll implement to support mental health of newcomer youth. So take a second and think, what is one thing that's jumping out at you or you're going to take away from this training? Being more observant. Yeah. Simple language shifts to destigmatize. Yeah. Focus on supporting children. Yeah. Validating feelings, cultural humility. Yeah, these are all really great. Cultural awareness, destigmatization. Yeah. Incorporating movement, no pressure, listen more, be culturally aware. Yeah, thank you all. Let's now talk about some resources for you. And let's recap what we've talked about. As Megan said, there was a lot that we covered today. So we hope that you take away from this presentation that you come away from this with an increased awareness of signs of emotional distress influencing newcomer children and youth well-being, culturally responsive approaches to discussing mental health with newcomer youth and their caregivers, and how and when to refer youth for additional support. We've gone through and I think answered almost all of the questions. There's one lingering one. Megan, if you want to unmute, I don't know if you have any understanding of quality or accessibility of interpretation with the 988 helpline.
Sure. My understanding is pretty limited. Just I know that it does exist, and that's about all that I know. Yeah, so sorry I don't have more to say about that. But I know it exists, and so sometimes that's going to be our best or only option. If you had an interpreter with you that the youth is already comfortable with, you could try to call, all together with an interpreter. Maybe that would go better. But yeah, sorry, I can't say more.
Yeah. So as you see, there's a QR code on the screen here. We'd like you, if you can, to take a minute and just fill out a short survey. It helps us improve our trainings and shape future trainings. So I'll just give you a second to scan that and fill that out. And there's the link as well in the chat. So for time's sake, I wanted to just highlight on our website, we have a case consultation helpline and how you can fill out a referral form. You can call this number here or email us if you have specific cases that you'd like us to help you to walk through and how we can do that. We also have a list of resources for you that we wanted to make available to you here. So if you go to the slides, there's mental health resources, there's stuff for managing and building capacity, and then there's resources for newcomer youth and their caregivers. And as a last little plug, we wanted to let you know that our next webinar is identifying, assessing, and responding to trafficking concerns involving refugee and newcomer youth. It will be on the last Wednesday of March, the 25th, at the same time from 2 to 3:30. So with that, thank you for joining us for today's presentation. We are exactly at 3:30, just went 3:31. But have a great day, everybody, and thanks for joining us.